Question 1. What is the very first action a rescuer should take upon arriving at a potential emergency scene? A. Check for the victim's responsiveness. B. Call 911 or emergency services. C. Ensure the scene is safe for themselves and the victim. D. Begin chest compressions immediately. Answer: C. Ensure the scene is safe for themselves and the victim. This question tests your understanding of the critical first step in any emergency, scene safety. The keyword very first action emphasizes that your personal safety and the safety of the environment must be assessed before approaching a victim. Approaching an unsafe scene, such as one with active traffic or hazardous materials, could put you in danger and prevent you from helping. For example, before helping someone who has collapsed in a street, you must ensure no cars are coming. Always remember, you can't help anyone if you become a victim yourself, so always check the scene first. Question 2. When performing CPR on an adult, what is the recommended compression depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. D. At least 2.5 inches 6.4 centimeters. Answer: C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. This question focuses on a crucial aspect of high-quality CPR, correct compression depth for adults. The phrase recommended compression depth highlights the specific measurement needed to effectively circulate blood to vital organs. Compressions must be deep enough to be effective, but not so deep as to cause injury. For example, pressing too lightly won't move blood sufficiently, while pressing too hard could cause internal damage. A good way to remember this is that 2 inches is roughly the depth of a credit card stood on its side, providing a visual cue for adequate depth. Question 3. What is the correct compression to ventilation ratio for a single rescuer performing CPR on an adult? A. 15 compressions to 2 ventilations. B. 30 compressions to 2 ventilations. C. 5 compressions to 1 ventilation. D. 10 compressions to 1 ventilation. Answer: B. 30 compressions to 2 ventilations. This question assesses your knowledge of the appropriate ratio for single rescuer adult CPR. The key phrases single rescuer and adult are important clues, as these ratios change based on the number of rescuers and the victim's age. This ratio ensures a balance between circulating oxygenated blood and providing additional oxygen through breaths. For instance, if you are alone with an adult victim, you will perform 30 chest pushes, then give 2 rescue breaths, and repeat this cycle. Keep in mind that consistent compressions are prioritized, but breaths are still vital. Question 4. After performing initial chest compressions on an unconscious adult with a foreign body airway obstruction, what should be the next action? A. Give 5 back blows. B. Perform abdominal thrusts. C. Look for the foreign object in the victim's mouth. D. Begin rescue breaths. Answer: C. Look for the foreign object in the victim's mouth. This question pertains to the modified CPR sequence for an unconscious adult with a choking obstruction. The keyword unconscious adult with a foreign body airway obstruction is critical, indicating that the standard CPR steps need an adjustment. After each set of 30 compressions, before attempting breaths, you should open the airway and visually check for the obstructing object. If you see the object and can easily remove it with a finger sweep, do so. This modification ensures you're attempting to clear the airway directly before trying to push air in. Question 5. What is the maximum amount of time you should interrupt chest compressions? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 15 seconds. D. No more than 20 seconds. Answer: B. No more than 10 seconds. This question emphasizes the importance of continuous chest compressions during CPR. The phrase maximum amount of time highlights the strict limit for interruptions. Pauses in compressions reduce blood flow to the brain and heart, diminishing the effectiveness of CPR. For example, when switching roles with another rescuer or preparing the AED, try to make the transition as quick as possible, ideally under 10 seconds. The goal is to keep blood circulating as consistently as possible to maintain vital organ function. Question 6. When should you activate the emergency response system, e.g., call 911? A. After 5 cycles of CPR. B. Only if you are unsure what to do. C. Immediately upon determining the victim is unresponsive and not breathing normally. D. After delivering one shock with an AED. Answer: C. Immediately upon determining the victim is unresponsive and not breathing normally. This question tests the crucial timing for activating emergency medical services, EMS. The phrase "activate the emergency response system" refers to calling for professional help, which is a critical step once you confirm a person is in cardiac arrest. Delaying this call means delaying definitive medical care. For instance, if you find an unresponsive adult, first check for breathing, and if abnormal or absent, immediately call 911 or send someone to do so while you prepare for CPR. Prompt activation ensures that advanced life support arrives as quickly as possible. Question 7. What is the recommended rate for chest compressions during CPR for all age groups, adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question addresses the universal compression rate for high-quality CPR across all age groups. The keyword "recommended rate" signifies the ideal speed at which to deliver chest compressions to maximize blood flow. This specific rate ensures enough compressions are delivered per minute to circulate blood effectively. A helpful way to maintain this rhythm is to compress to the beat of a song like "Stayin' Alive" by the Bee Gees, as its tempo is within this target range. Remember, consistent rhythm and adequate depth are both critical for effective CPR. Question 8. For an adult, where should the AED pads be placed? A. One pad on the upper right chest and one on the lower left side of the chest. B. Both pads on the left side of the chest. C. One pad on the upper left chest and one on the lower right side of the back. D. Both pads on the stomach. Answer: A. One pad on the upper right chest and one on the lower left side of the chest. This question focuses on the correct placement of AED pads for an adult, which is vital for the device to effectively deliver an electrical shock across the heart. The upper right chest refers to just below the collarbone, and the lower left side of the chest refers to below the left armpit, ensuring the electrical current passes through the heart. Incorrect placement could render the shock ineffective. For example, imagine drawing a diagonal line across the chest, with the heart in the middle, and placing the pads on opposite ends of this line. Proper placement is essential for the AED to analyze the heart rhythm accurately and deliver therapy. Question 9. What should you do immediately after an AED delivers a shock? A. Reassess the victim's pulse. B. Turn off the AED. C. Resume chest compressions immediately, starting with compressions. D. Remove the AED pads. Answer: C. Resume chest compressions immediately, starting with compressions. This question highlights the critical action following an AED shock. The keyword "immediately after an AED delivers a shock" is crucial because prompt resumption of CPR, specifically compressions, is paramount. The shock is designed to stop the abnormal heart rhythm, but it doesn't guarantee the heart will restart or that a normal rhythm will be sustained. For instance, after the AED announces shock delivered, you should quickly lean over the victim and continue chest compressions without delay. The goal is to provide continuous blood flow to the brain and heart until advanced medical help arrives. Question 10. How do you open the airway of an unresponsive victim who is suspected of having a neck or spinal injury? A. Head tilt chin lift maneuver. B. Jaw thrust maneuver. C. Turn the victim onto their side. D. Use a bag mask device. Answer: B. Jaw thrust maneuver. This question tests your knowledge of the preferred airway opening technique when a spinal injury is suspected. The keywords unresponsive victim and suspected of having a neck or spinal injury are key clues, as the standard head tilt chin lift could worsen such an injury. The jaw thrust maneuver aims to open the airway by lifting the jaw without tilting the head, thus minimizing neck movement. For example, if someone fell from a height, assume a spinal injury and use this gentle technique. Always prioritize protecting the spine when there's any doubt about injury. Question 11. What is the primary characteristic of high-quality chest compressions? A. Being delivered slowly and gently. B. Being interrupted frequently to check for a pulse. C. Being deep, fast, allowing for full chest recoil, and minimizing interruptions. D. Being performed only when a second rescuer is present. Answer: C. Being deep, fast, allowing for full chest recoil, and minimizing interruptions. This question asks about the essential components of high-quality chest compressions, which are fundamental to effective CPR. The keywords primary characteristic refer to the most important aspects that contribute to successful outcomes. High-quality compressions involve pressing hard, deep, pressing fast, at least 100 per minute, allowing the chest to fully return to its normal position after each compression, full recoil, and avoiding unnecessary pauses. For instance, if you're performing CPR, focus on maintaining a consistent rhythm and depth while letting the chest come all the way back up between pushes. Every compression needs to be effective to circulate blood efficiently. Question 12. You are alone and find an unresponsive infant. After checking for responsiveness and no normal breathing, what should be your next action? A. Immediately begin chest compressions. B. Deliver 2 rescue breaths. C. Call 911 or activate the emergency response system. D. Give 5 back blows and 5 chest thrusts. Answer: C. Call 911 or activate the emergency response system. This question addresses the specific sequence for a single rescuer with an unresponsive infant. The keywords alone and unresponsive infant are crucial, as the protocol differs from adults when you are the only rescuer and witness the collapse. For infants and children, cardiac arrest is often respiratory in origin, so calling for help immediately rather than starting CPR first is prioritized if you're alone and did not witness the collapse. However, if you witness the infant's collapse, you would start CPR immediately for 2 minutes before calling for help. Question 13. When is it appropriate to place an adult victim in the recovery position? A. When the victim is unresponsive and not breathing normally. B. When the victim is unresponsive, breathing normally, and has no suspected spinal injury. C. When the victim is responsive and complains of chest pain. D. When the victim is choking and still conscious. Answer: B. When the victim is unresponsive, breathing normally, and has no suspected spinal injury. This question focuses on the appropriate circumstances for using the recovery position. The key conditions unresponsive, breathing normally, and no suspected spinal injury indicate when it is safe and beneficial to place a victim on their side. This position helps keep the airway open and prevents aspiration, breathing in vomit or fluids, while waiting for advanced medical help. For example, if someone collapses but is still breathing regularly, turning them onto their side can protect their airway. Remember, never put someone in the recovery position if they are not breathing or if you suspect a head, neck, or back injury. Question 14. What is the correct hand placement for chest compressions on an adult? A. On the lower half of the breastbone, sternum. B. On the upper half of the breastbone, sternum. C. Directly over the xiphoid process, tip of the sternum. D. On the left side of the chest, directly over the heart. Answer: A. On the lower half of the breastbone, sternum. This question targets the precise hand placement for effective adult chest compressions. The keyword hand placement is critical, as correct positioning ensures compressions are delivered over the heart, maximizing blood flow and minimizing injury. Placing your hands on the lower half of the breastbone allows for proper force distribution and access to the heart without pressing on delicate areas like the ribs or the xiphoid process. Imagine drawing a line between the nipples. Your hands should be centered on the chest, just below that line. Proper hand placement helps deliver efficient and safe compressions. Question 15. What is the first step when dealing with a conscious adult who is choking and cannot speak, cough, or breathe? A. Begin chest compressions. B. Deliver 5 back blows. C. Call 911 immediately. D. Perform abdominal thrusts, Heimlich maneuver. Answer: D. Perform abdominal thrusts, Heimlich maneuver. This question addresses the initial intervention for a conscious adult experiencing severe choking. The keywords conscious adult who is choking and cannot speak, cough, or breathe signify a complete airway obstruction requiring immediate action. Abdominal thrusts are the primary and most effective method for dislodging the object in a responsive choking adult. For instance, if you see an adult clutching their throat and unable to make a sound, stand behind them and begin abdominal thrusts. Continue until the object is expelled or the person becomes unconscious. Question 16. What is the recommended compression depth for an infant during CPR? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters or about 1/3 the depth of the chest. C. At least 2 inches 5 centimeters. D. At least 2.4 inches 6 centimeters. Answer: B. At least 1.5 inches 3.8 centimeters or about 1/3 the depth of the chest. This question focuses on the specific compression depth required for infant CPR. The keyword infant is crucial, as the depth is shallower than for children or adults to prevent injury while still being effective. This depth, approximately 1/3 the chest's anterior-posterior diameter, is sufficient to compress the infant's small heart. For example, when performing 2-finger compressions on an infant, aim to press down about the length of your thumb from the knuckle to the tip. Accurate depth is vital to circulate blood effectively without causing harm to the delicate infant body. Question 17. How should you assess for normal breathing in an unresponsive victim? A. Look, listen, and feel for no more than 30 seconds. B. Look for chest rise and fall for at least 5 seconds but no more than 10 seconds. C. Feel for a pulse in the carotid artery for 5 to 10 seconds. D. Ask the victim if they are breathing. Answer: B. Look for chest rise and fall for at least 5 seconds but no more than 10 seconds. This question tests the correct method and duration for assessing normal breathing in an unconscious person. The keywords assess for normal breathing and unresponsive victim are important. You should quickly observe the chest and abdomen for visible movement, which indicates breathing, but avoid prolonged assessment that delays CPR. For example, after opening the airway, quickly scan the chest for any rise and fall. Gasping or irregular breaths are not considered normal breathing. This quick check helps you determine if CPR is necessary without wasting precious time. Question 18. When assessing an unresponsive adult, what is the best location to check for a pulse? A. Radial artery, wrist. B. Brachial artery, upper arm. C. Femoral artery, groin. D. Carotid artery, neck. Answer: D. Carotid artery, neck. This question asks about the most reliable pulse check location for an unresponsive adult. The carotid artery is preferred because it is a large, central artery that often maintains a palpable pulse even when peripheral pulses are too weak to feel. To check, gently feel in the groove beside the trachea, windpipe, in the neck. For instance, if you find an unresponsive person, after ensuring the scene is safe and activating EMS, quickly check for a pulse in their neck for no more than 10 seconds. A quick and accurate pulse check helps determine if chest compressions are needed. Question 19. What is the first step you should take if you suspect an opioid overdose and the person is unresponsive and not breathing normally? A. Immediately begin chest compressions. B. Administer naloxone, if available and trained. C. Place them in the recovery position. D. Perform abdominal thrusts. Answer: B. Administer naloxone, if available and trained. This question addresses the specific initial intervention for a suspected opioid overdose. The keywords opioid overdose, unresponsive, and not breathing normally highlight a situation where a specific medication can be life-saving. Naloxone is a medication that can rapidly reverse the effects of opioid overdose by blocking opioid receptors. If available and you are trained, administering naloxone is a crucial first step, followed by calling for help and potentially starting CPR if the person remains unresponsive and not breathing. For example, if someone has pinpoint pupils and shallow breathing after suspected drug use, giving naloxone could quickly restore their breathing. Question 20. What is the universal sign of choking in a conscious person? A. Rapid, shallow breathing. B. Grabbing at the throat with one or both hands. C. Coughing forcefully. D. Cyanosis, bluish skin discoloration. Answer: B. Grabbing at the throat with one or both hands. This question identifies the key indicator of a severe airway obstruction in a conscious individual. The universal sign of choking is a distinctive, widely recognized gesture that signals distress and inability to breathe. This nonverbal cue is critical because a person who is truly choking cannot speak or cough effectively. For example, if someone at dinner suddenly clutches their neck, it's a clear sign they are choking and need immediate help. Recognizing this sign quickly allows you to intervene before the situation worsens. Question 21. When a pregnant woman requires CPR, what additional consideration should be given? A. Avoid using an AED. B. Displace the uterus to the left side. C. Perform compressions higher on the sternum. D. Give only rescue breaths, no compressions. Answer: B. Displace the uterus to the left side. This question addresses a specific modification for CPR on a pregnant woman. The keyword pregnant woman is the clue, as the enlarged uterus can compress major blood vessels, impairing blood flow back to the heart and to the fetus. Manually displacing the uterus to the left side, or having the woman tilted, helps relieve this compression, improving circulation for both mother and baby. For example, if you are performing CPR on a pregnant woman, gently push or pull her uterus to the left side to help blood flow more freely. This simple action can significantly improve the effectiveness of CPR. Question 22. What is the recommended compression to ventilation ratio for a child when two rescuers are present? A. 30 compressions to 2 ventilations. B. 15 compressions to 2 ventilations. C. 5 compressions to 1 ventilation. D. 10 compressions to 1 ventilation. Answer: B. 15 compressions to 2 ventilations. This question specifically asks about the 2 rescuer CPR ratio for a child. The critical clue is 2 rescuers and child, as the ratio changes to allow for more frequent ventilations due to the common respiratory cause of cardiac arrest in children. When 2 rescuers are present, it's easier to maintain this higher ratio of breaths. For instance, one rescuer can focus on compressions while the other provides breaths, switching roles periodically. This team approach allows for more effective ventilation and blood circulation for the child. Question 23. You find an infant who is conscious but has a complete airway obstruction, choking. What is the recommended first aid? A. Abdominal thrusts, Heimlich maneuver. B. 5 back blows followed by 5 chest thrusts. C. Mouth-to-mouth resuscitation. D. Chest compressions only. Answer: B. 5 back blows followed by 5 chest thrusts. This question focuses on the appropriate first aid for a conscious choking infant. The keywords conscious and infant are key, as the technique for infants differs significantly from adults or children. The combination of back blows and chest thrusts is designed to dislodge the object effectively from an infant's small airway. For example, hold the infant face down along your forearm, deliver 5 back blows between the shoulder blades, then turn them face up and deliver 5 chest thrusts with 2 fingers on the breastbone. Continue alternating until the object is expelled or the infant becomes unresponsive. Question 24. What is the correct method for giving rescue breaths to an infant using a mouth-to-mouth and nose technique? A. Pinch the nose closed and seal your mouth over the infant's mouth. B. Seal your mouth over the infant's mouth and nose. C. Place your mouth over the infant's mouth, and hold the chin up to keep the nose open. D. Give small puffs of air only into the nose. Answer: B. Seal your mouth over the infant's mouth and nose. This question specifically describes the correct technique for delivering rescue breaths to an infant. The keyword infant indicates that their smaller facial features require a different approach than an adult or child. By sealing your mouth over both the infant's mouth and nose, you ensure an effective seal to deliver the small puffs of air needed to make the chest rise. For example, gently tilt the infant's head to a neutral position, then place your mouth over both their mouth and nose and give a small puff of air for about 1 second. This method ensures air goes into the lungs without significant leakage. Question 25. In a 2-rescuer adult CPR scenario, how often should rescuers switch roles, compressor and ventilating rescuer? A. Every 5 minutes. B. Every 2 minutes or after 5 cycles of CPR. C. Only when the compressor becomes exhausted. D. After every 30 compressions. Answer: B. Every 2 minutes or after 5 cycles of CPR. This question addresses the important aspect of role switching in 2-rescuer CPR, which is crucial for maintaining high-quality compressions. The keywords 2-rescuer adult CPR and switch roles are key, as frequent switching helps prevent compressor fatigue, which can lead to shallower and less effective compressions. Changing roles approximately every 2 minutes or after 5 cycles of 30:2 compressions and breaths ensures that the compressor remains fresh and capable of delivering effective chest compressions. This systematic rotation helps ensure continuous, high-quality CPR is maintained until advanced help arrives.